Welcome to Med Madness, your go-to podcast for mastering USMLE Step 2. I'm your host, and today we're diving into a crucial topic, labor epidural analgesia and its side effects. This episode is especially important for those of you preparing for clinical practice or exams, as understanding the nuances of epidural analgesia can significantly impact maternal and fetal outcomes. Next, let's discuss epidural analgesia. Epidural analgesia is a widely used method for pain relief during labor. It involves the administration of a combination of local anesthetics like bupivacaine and opioids such as fentanyl through a catheter placed in the epidural space below the L4 vertebra. This technique provides continuous pain relief throughout labor by blocking specific nerve fibers. During the first stage of labor, uterine contractions cause significant pain. This pain is transmitted through the T10L1 nerve fibers. The epidural blocks these fibers, effectively reducing pain during contractions. As labor progresses to the second stage, perineal stretching adds to the discomfort, which is managed by blocking the S2-S4 nerve fibers. However, the analgesic effects extend beyond just pain relief. The L2-L5 sympathetic fibers, which regulate lower extremity blood vessel tone, are also affected. Blocking these fibers leads to vasodilation and venous pooling in the lower extremities. This redistribution of blood can cause a significant drop in blood pressure, a condition known as Epidural-Associated Hypertension. Epidural-associated hypertension is a common side effect that occurs due to the pooling of blood in the lower extremities, reducing venous return to the heart. Consequently, there's a decrease in cardiac output, often resulting in lightheadedness and hypertension. In response to this reduced cardiac output, the body attempts to compensate with tachycardia. Managing this hypertension is crucial for both maternal and fetal well-being. One effective method is changing the maternal position to the left, known as left uterine displacement, which helps improve venous return. Additionally, administering an intravenous fluid bolus can increase blood volume, counteracting the hypertension. In more severe cases, vasopressors like phenylephrine or ephedrine may be used to stabilize blood pressure. It's also essential to differentiate epidural-associated hypertension from other conditions that can present similarly. For instance, amniotic fluid embolism typically involves a triad of hypertension, hypoxia, and coagulopathy, often accompanied by increased bleeding and pulmonary edema. High spinal or total spinal anesthesia can occur if the epidural catheter accidentally punctures the dura, leading to an exaggerated ascending paralysis and respiratory complications, which are not observed with standard epidural-associated hypertension. Let's bring this to life with a real case study. Imagine a 32-year-old woman in active labor receiving epidural analgesia. Shortly after the administration, she begins to feel lightheaded and her blood pressure drops significantly. The fetal heart monitor starts showing late decelerations, indicating potential fetal distress. The medical team quickly springs into action, repositioning her to the left to improve venous return. An intravenous fluid bolus is administered, and a vasopressor is given to stabilize her blood pressure. Within minutes, her symptoms improve, and the fetal heart rate returns to normal. This swift intervention highlights the importance of recognizing and managing epidural-associated hypertension to ensure both maternal and fetal safety. In conclusion, while epidural analgesia is an effective and commonly used method for pain relief during labor, it's crucial to be aware of its side effects, particularly hypertension. Understanding the mechanism, effects, and management strategies can significantly improve outcomes for both mother and child. Thank you for tuning in to Med Madness. Stay tuned for our next episode where we'll continue to explore key topics for your USMLE Step 2 preparation. Until then, keep learning and stay curious.